बिस्मिल्लाहिर्रहमानिर्रहीम। अस्सलामुअलैकुम। उम्मीद है आप सब खैरियत से हैं। आज की वीडियो में मैं आपको ह्यूमन नेचर मदर एंड चाइल्ड के दरमियान जो रिलेशन है हेल्थ केयर का, उसके बारे में बताऊंगी। स्टार्ट करते हैं अपना टॉपिक। ऑब्जेक्टिव्स हैं मदर एंड चाइल्ड हेल्थ प्रॉब्लम्स, माल न्यूट्रिशन, इन्फेक्शियस material and child health, antenatal care, postnatal care, neonatal care, growth and development। ये तो है टॉपिक मदर एंड चाइल्ड केयर। और इसके अलावा हम इस वीडियो में देखेंगे मदर एंड चाइल्ड ट्रेनिंग्स एंड कम्युनिकेशन। स्टार्ट करते हैं पहले मदर एंड चाइल्ड ट्रेनिंग एंड कम्युनिकेशन से। देन मदर एंड चाइल्ड हेल्थ केयर जो है उसके बारे में मैं आपको बताऊंगी। Women not trained for important aspect of life, motherhood. Design in Indian context to watch social cultural background and attitudes to health, women and motherhood। Objectives and benefits देख लेते हैं। Physical, mental, social and material preparedness for pregnancy and childbirth. Competency in dealing with pregnancy. Experience of fitness and energy through pregnancy. Improved health, wellness and comfort during pregnancy. To have easier, shorter, confident and participatory labor। objective and benefits देखते हैं। To alleviate fears and regarding labor, optimum recovery and good health of mother, active involvement of husband and family। Holistic approach to pregnancy, taking care of physical, intellectual, emotional, social, occupational and spiritual aspects। Successful breastfeeding, optimum physical and emotional growth of children, better child care practices, freedom from myths and misbeliefs, nourishment for body and mind, optimum fetal growth। Details of projects and trainings। देख लेते हैं अब मदर एंड चाइल्ड हेल्थ केयर। The first one is mother and child health problems। In developing countries, the primary concern is reduction of maternal and child mortality and morbidity, spacing of pregnancies, limitation of family size, prevention of communicable disease, improvement of nutrition, and promoting acceptance of health practices। Main health problems affecting the health of the mother and the child: the trade of malnutrition, infection, and the consequences of unregulated fertility। malnutrition, तो सेकंड जो है वो है माल न्यूट्रिशन। The adverse effects of maternal malnutrition are maternal depletion, low birth weight, anemia, toximesis of pregnancy, postpartum hemorrhage. All of the above causes leading to high mortality and morbidity. The intrauterine period of life is a very important period from the nutritional standpoint. The critical period of childhood is the period of weaning. Severe malnutrition coincides with the age at which babies are usually weaned. Susceptibility to infection and severity of illness are significantly less in well-nourished than in malnourished children. Nutrition protection and promotions therefore an essential activity of HCM care. Measures to improve the nutritional status of mothers and children may be broadly divided into direct and indirect nutrition intervention. Direct interventions cover a wide range of activities, while supplementary feeding programs, distribution of iron and folic acid tablets, fortification and enrichment of foods, nutrition, education, etc. Indirect nutrition interventions have still wider ramifications because they are not specifically related to nutrition. These include measures such as control of communicable disease through immunization, improvement of environmental situations, provision of clean drinking water, family planning, food hygiene, education, and primary health care. Mental infections may cause a variety of adverse effects, such as fetal growth retardation, low birth weight, embryopathy, abortion, and puerperal sepsis. Many women are infected with HIV, hepatitis B, cytomegaloviruses, herpes, simplex viruses, or toxoplasma, and during pregnancy. The baby is concerned, infection may begin with labor and delivery and increase as the child grows older. Children may be ill with debilitating diarrhea, respiratory and skin infections for as much as a third of the first year of life. The situation is further aggravated by such chronic infection as malaria and tuberculosis. नेक्स्ट देख लेते हैं. The occurrences of multiple and frequent infections may precipitate in the children a severe protein allergy, malnutrition, and anemia. It is now widely recognized that children in developing areas need to immunize against 6 infection tuberculosis. The first one is diarrhea, the second one is whooping cough, the third one is tetanus, the fourth one is measles, and the next is polio. So, education of mothers in medical measures such as oral rehydration in diarrhea and febrile disease is being tried. In addition, a good knowledge and practice of personal hygiene and appropriate sanitation measures, particularly in and around the home, are essential prerequisites for the control of the most infectious and parasite disease. नेक्स्ट टॉपिक है अनकंट्रोल्ड रिप्रोडक्शन. सो इसको स्टार्ट करने से पहले आप ये कुछ जो चीज़ें ये नोट कर लें. The health hazards for the mother and the child resulting from unregulated fertility have been well recognized. Increased prevalence of low birth weight babies, severe anemia, abortion, postpartum hemorrhage, and high maternal preternatal mortality, which have shown a sharp rise after the fourth pregnancy. Introduction of new types of IUD, easier and safer techniques for pregnancy termination and female sterilization. Oral pills and long-acting injectable medroxy Oral pills and long-acting injectable methoxyprogesterone Accutane यानी MPA have contributed a good deal in the utilization of family planning services. The term maternal and child health refers to a promotive, preventive, curative, and rehabilitative health care for mothers and children. It includes the sub-areas of maternal health, child health, family planning, school health, handicapped children, adolescents, and health aspects of care of children in special settings such as daycare. The specific objective of MCHR: reduction of maternal, paternal, infant, and childhood mortality and morbidity. Number B, promotion of reproductive health. Number C, promotion of the physical and psychological development of the child and adolescent within the family. The ultimate objective of MCH service is lifelong health. Antenatal care. Antenatal care is the care of the woman during pregnancy. The primary aim of the antenatal care is to achieve at the end of the pregnancy a healthy mother and a healthy baby. Ideally, this care should begin soon after conception and continue throughout pregnancy. Objectives of antenatal care are: the number 1 is to promote, protect, and maintain the health of the mother during pregnancy. Number 2 is to detect high risk cases and give them special attention. Number 3 is to foresee complications and prevent them. The number 4 is to remove anxiety and dread associated with delivery. The number 5 is to reduce maternal and infant mortality and morbidity. Number 6 is to teach the mother elements of child care, nutrition, personal hygiene, and environmental sanitation. To sensitize the mother to the need for the family planning, including advice to cases seeking medical termination of pregnancy. And number 8 is to attend to the under 5 accompanying the mother. Next है antenatal visits. Ideally, the mother should attend the antenatal clinic once a month during the first 7 months, twice a month during the next month, and thereafter once a week if everything is normal. Consequently, it is difficult for low-case people to attend the antenatal clinic so often. In these cases, a minimum of 4 visits covering the entire period of pregnancy should be the target, as shown below. The suggested schedule is as follows. First visit within 12 weeks, preferably as soon as the pregnancy is suspected, for registration of pregnancy and first antenatal checkup. Second visit between 14 and 26 weeks. Third visit between 28 and 34 weeks. Fourth visit between 36 weeks and term. These cases comprises the following. The number 1 is elderly premier, 30 years and over. Number 2 is short-stuttered preemie, 140 cm and below. The third one is malpresentations, wise, breech, transverse lie, etc. Malpresentation, antepartum, hemorrhage, threaten abortion. Number 5, preeclampsia and eclampsia. Number 6 is anemia. Number 7 is twins hydromenons. Number 9 is elderly granulopars. Number 10 is prolonged pregnancy, 14 days after expected date of delivery. Pregnancy associated with general diseases, wise, cardiovascular disease, kidney disease, diabetes, malaria, tuberculosis, liver disease, convulsives, asthma, HIV, RT, ST, and etc. Number 13 is treatment for infertility. Number 14 is 3 or more spontaneous consecutive abortions. डाइट देख लेते हैं, डाइट उस दौरान क्या होनी चाहिए. Reproduction costs energy. Next is a pregnancy in total duration consumes about 60,000 calories over normal metabolic requirements. Lactation demands about 550 cal a day. Further child survival is correlated with birth weight. And birth weight is correlated to the weight gain of the mother during pregnancy. Several studies have indicated that weight gain of poor Indian women averaged 6.5 kg during pregnancy. If material stores of iron are poor, as may happen after repeated pregnancies, and if enough iron is not available to the mother during pregnancy, it is possible that fetus may lie down insufficient iron stores. Such a baby may show a normal hemoglobin at birth, but will lack the stores of iron necessary for rapid growth and increase in blood volume and muscle mass in the first year of life. डाइट के बाद आता है नेक्स्ट पर्सोनल हाइजीन. पर्सोनल हाइजीन क्या होनी चाहिए? पर्सनल क्लीनेंस, the need to be bathed every day and to wear clean clothes should be explained. The hair should be also be kept clean and tidy. Number B is rest and sleep. 8 hours sleep and at least 2 hours rest after midday meals should be advised. Number C is bowels. Then constipation should be avoided by regular intake of green leafy vegetables. Constipation should be avoided by regular intake of green leafy vegetables, fruits, and extra fluids. Purgatives like castor oils should be avoided to relieve constipation. Exercise. Light household work is advised, but manual physical labor during late pregnancy may adversely affect the fetus. Number E is smoking. Smoking should be cut down to a minimum. Expectant mothers who smoke heavily produce babies much smaller than the average. It is because nicotine has a vascular influence in the uterus and induces a degree of placement insufficiently. The adverse effects of smoking range from low birth weight to an increased risk of perinatal death of the infant. Women who smoke during pregnancy give birth to babies which on average weight 170 gram less at term than the babies of non-smokers. Number F is alcohol. Next is evidence is mounting that alcohol can be cause a range of fertility problems in women. Heavy drinking has been associated with the fetal syndrome means FAS, which includes intrauterine growth retardation, development delay. More recently, it has been shown that the consumption of even moderate amount of alcohol during pregnancy is associated with an increased risk of spontaneous abortions. Dental care. Advice should also be given about oral hygiene. नेक्स्ट है dental care. Advice should also be given about oral hygiene, sexual intercourse. This should be restricted especially through the last trimester. This should be restricted especially during the last trimester. Number third is drug. The classical example is thalidomide,
a hypotonic drug, which cause deformed hands and feet of the baby is born. Other examples are LSD, which is known to cause chromosome damage, streptomycin, which may cause eighth nerve damage and deafness in the fetus, endone containing preparations, which may cause congenital goiter in the fetus. Corticosteroids may impair fetal growth. Sex hormones may produce racemium. Tetracyclines may affect growth of bones and enable formation of teeth. Anesthetic agents including pethidine administered during labor can have depressed effect on the baby and delay the onset of effective respiratory. Later, still in the perineum, if the mother is breastfeeding, there can certain drugs which are executed in breastfeeding. The next is warning signs. वार्निंग साइंस की हेडिंग देख लेते हैं. The mother should be given clear-cut instruction that she should report immediately in case of the following warning signals. Number A is swelling of the feet. Number B is fits. Number C is headache. Number D is blurring of the vision. Bleeding or discharge per vagina. And the number F is any other unusual symptoms. Child care. The art of child care has to be learned. Special cases are held for mothers attending antenatal clinics, mothercraft education consists of nutrition education, advice on hygiene and children cooking demonstration, family planning, education, family budgeting. The next is specific health protection. Anemia. Surveys in It is well known that anemia per se is associated with high incidence of premature births, postmortem, hemorrhage, puerperal sepsis, and thromboembolic phenomena in the mother. The Government of India has initiated a program in which 100 mg of elemental iron and 500 mcg of folic acid are being distributed daily for 100 days to pregnant women during outer nutritional deficiencies. The mother should be protected against other nutritional deficiencies that may occur, particularly protein, vitamin, and minerals, especially Vit A and iodine deficiency. Toximesis of pregnancy. The presence of albumin in urine and an increase in blood pressure indicates toximesis of pregnancy. Their early detection and management are indicated. Efficient antenatal care minimizes the risk of toximesis of pregnancy. Tetanus. If the mother is not immunized earlier, 2 doses of absorbed tetanus toxin should be given the first dose at 16 to 20 weeks. And the second dose at 20 to 24 weeks of pregnancy. The minimum interval between the 2 doses should be 1 month. No pregnant woman should be denied even 1 dose of tetanus toxin if she is seen late in pregnancy. For a woman who has been immunized earlier, 1 booster dose will be sufficient. When such booster has been given, it will provide necessary cover for subsequent pregnancies during the next 5 years. If it is advised not to inject tetanus toxide at very successive pregnancy because of the risk of hyperimmunization and side effects. Syphilis. Pregnancy is women with primary and secondary syphilis often end in spontaneous abortions, stillbirths, parental death, or the birth of a child with congenital syphilis. Neurological damage with mental retardation is one of the most serious consequences of congenital syphilis. When the mother is suffering from syphilis, infection of the fetus does not occur before the 4th month of pregnancy. It is most likely to occur after the 6th month, by which time the Langerhans cell layer the complete atrophied. German measles. When rubella was contracted in the first 16 weeks of pregnancy, fetal death or damage during the first year of life occurred in the offspring of 17% of the pregnancies. Among survivors who were followed up to age 8 years, 15% and major defects of which contract, deafness and congenital heart disease were the most common. It appears that the risk of all degree of malformation may remain in the region of 20% up to the 20th week. Vaccination of all school-age children with rubella vaccine. Supplementary, the community control of infection is the vaccination of all women of childbearing age who are seronegative. Before vaccinating, it is advisable that pregnancy be ruled out and effective contraceptions be maintained for 8 weeks after vaccination because of the possible risk to the fetus from the virus. HIV infection. HIV may pass from an infected mother to her fetus. जो HIV है वो पास हो सकता है जो भी infected mother है उसके fetus में, through the placenta or to her infant during delivery or by breastfeeding in ज़राए के through. About 1/3 of the children of HIV positive mothers get infected through this route. Separate of infection from HBV, carrier mothers to their babies appears to be a factor for the high prevalence of HBV infection in some regions. The mechanism of perinatal infection is uncertain. Most infections appear to occur at birth. Transmission of the virus to the baby after delivery is likely if both surface antigen and an antigen are positive. Vertical transmission can be blocked by immediate post-delivery administration of B immunoglobulin and hepatitis B vaccination. Parental genetic screenings. Parental genetic screening includes screening for chromosomal abnormalities associated with serious birth defects, screening for direct evidence of congenital structure anomalies, and screening for hemoglobin pathologies and other inherited conditions detectable by a biochemical assay. Typical examples are screening of trisomy 21st Down syndrome and severe neural tube defects. नेक्स्ट है फैमिली प्लानिंग. Family planning is related to every phase of maternity cycle. The mother is psychological more respective to advise on family planning than at other times. Educational and motivational efforts must be initiated during the antenatal period. If the mother has two or more children, she could be motivated for peripheral sterilization. In this connection, the All India Postpartum Program services are available to all expectant mothers in India. Postpartum sterilization is generally recommended on the second day after delivery. Although lactation confers some protection against conceptions, it cannot be depended upon. Contraceptives have to be supplied immediately. Postpartum depends upon contraceptive have to be supplied immediately postpartum. IUD and conventional contraceptives are the choices during the first 6 months following delivery. In general, combined or sequential oral pills should be avoided in lactating mother as they do suppress lactation. Next है Antenatal care. Leukemia may result from unskilled and manipulations, and tetanus neonatal from the use of unsterilized fosters. The emphasis is on the cleanliness. It entails clean hands and fingernails, a clean surface for delivery, clean cord care, clean blade for cutting the cord, and clean tie for the taut. No application on cord stump and keeping birth canal clean by avoiding harmful practices. Hospitals and health centers should be equipped for delivery with midwifery kits, a regular supply of certain gloves and wraps, towel cleaning material, soap, and antiseptic solutions, as well as equipments for sterilization, instruments, and supplies. They are delivering kits available with the items needed for the basic hygiene for delivery at home. Where a midwife with a midwifery kit is not likely to be present, the aims of good internet care are: the number one is through auspices. The number two is delivery with minimum injury to the infant and mother, readiness to deal with complications such as prolonged labor, antenatal hemorrhage, convulsive malpresentation, prolapse of the cord. Number fourth is care of the baby at delivery, restrictions, care of the cord, care of the eyes, and etc. Next है domiciliary care. This is known as domiciliary midwifery service. The advantage of the domiciliary midwife services are: the number one is mother delivers in the familiar surroundings of her home, and this may tend to remove the fear associated with delivery in a hospital. The chance for cross infections are generally the mother delivers in the familiar surroundings of her home, and this may tend to remove the fear associated with delivery in a hospital. Number second is the chances for cross infections are generally fewer at home than in the nursery hospital. The number third is the mother is able to keep an eye upon her children and domestic affairs. This may tend to ease her mental tensions. Domiciliary midwifery is also not without disadvantages. The number first is the mother may have less medical and nursing supervision than in the hospital. The number second is the mother may have less rest. The third one is she may resume her domestic studios too soon. The next is her diet may be neglected. Strictly speaking, many homes in India are unsuitable for every abnormal delivery. The arguments that childbirth is a natural event and should take place at homes does not guarantee that everything will be normal. The danger signals are sluggish pains or no pains after rupture of membranes, good pains for an hour after rupture of membranes but no progress. Number third is proposal of the cord or a hand. Number fourth is meconium, standard, liquor or slow, irregular or excessively fast fetal heart. Number fifth is excessive show or bleeding during labor. Number sixth is colpast during labor. Number seventh is a placenta not separated within the half an hour after a delivery. Number 8 is postpartum hemorrhage or colpast. Number 9 is a temperature of 38 degrees Celsius or over during labor. There should be a close lay-in between domiciliary and institutional delivery services. नेक्स्ट है इंस्टीट्यूशनल केयर. इसके कुछ पॉइंट्स हैं जो आप नोट कर लें.
About 1% of deliveries tend to be abnormal and 4% difficult, requiring the services of a doctor. Institutional care is recommended for high risk cases and where home conditions are unreliable. The mother is allowed to test in bed on the first day after delivery. From the next day, she is allowed to be up and about. The current practice is to discharge the woman after 5 days laying in period after a normal delivery. Roaming in. Keeping the baby's crib by the side of the mother's bed is called roaming in. This arrangement gives an opportunity for the mother to know her baby. Mothers interested in breastfeeding usually find there is better chance for success with roaming in. Roaming in also allies the fear in the mother's mind that the baby is not misplaced in the central nurseries. It also built up her self-confidence. Postnatal care. Care of the mother. The objectives of the postpartum care are: the number one is to prevent complications of the postpartum period. The number two is to provide care for the rapid restoration of the mother to optimum health. Number third is to check adequacy of breastfeed. The number fourth is to provide family planning services. The fifth is to provide basic health education to the mother family. Next है complications. Puerperal species. This is infection of the genital tract within 3 weeks after delivery. Rise in temperature and pulse rate. The next one is foul smelling lochia. The next is pain and tenderness in lower abdomen, etc. The next is puerperal sepsis can be prevented by attention to asbestos before and after delivery. This is particularly important in domiciliary midwifery services. The number second is thrombophlebitis. This is an infection of the veins of the legs, frequently associated with varicose veins. This leg may become tender, pale, and swollen. Secondary hemorrhage. Bleeding from a vagina anytime from 6 hours after delivery to the end of the puerperium 6 weeks is called secondary hemorrhage and may be due to retained placentia or membranes. The other is urinary tract infections and mastitis, etc. It is extremely important to look for these complications is the postpartum period and prevent or treat them properly. The next heading is restoration of mother to optimum health. The second objective of postpartum care is to provide care whereby the woman can recuperate physically and emotionally from the experience of delivery. The broad areas of this care fall into three divisions. The number one is postnatal examinations. Soon after delivery, the health checkups must be frequent, twice a day during the first 3 days, and subsequently once a day till the umbilical cord drops off. Check temperature, pulse, and respiration. Examines the breasts, checks progress of normal involutions of uterus, examine loggia for any abnormality, checks urine and bowels and advises on perineum, toilet including care of the stitches, if any. Further visits should be done once a month during the first 6 months and thereafter once in 2 or 3 months till the end of the year. So these are the restoration of mother to optimum health. The postnatal care of the mother. The objectives of postnatal care are to prevent complications of the postpartum period, to provide care for the rapid restoration of the mother to optimum health, the number third is to check adequacy of breastfeeding. The number fourth is to provide family planning services. The number fifth is to provide basic health education to mother family. The arguments that childbirth is a natural event and should take place at home does not guarantee that everything will be normal. The danger signals are: the number first is sluggish pains or no pains after rupture of membranes.
Good pains for an hour after rupture of membranes, but no progress. Proposals of the cord or hand. Meconium stain, liquor, or a slow, irregular, or excessively fast fetal hurt. Excessive show or bleeding during labor. Colpos during labor. A placenta not separated with half an hour after delivery. Postpartum hemorrhage or colpos. Number 9 is a temperature of 38 degrees Celsius or over during labor. The next is there should be a close line between domiciliary and institutional delivery services. The next is domiciliary care. Mothers with normal obstetric history may be advised to have their confinement in their own homes, provide the home conditions satisfactory. In such cases, the delivery may be conducted by the health worker female or trained DAI. This is known as domiciliary midwifery services. The advantages of the domiciliary midwifery services are the mother's delivery in the familiar surroundings of her home, and this may tend to remove the fear associated with the delivery in a hospital. Number second is the chances for loss infections are generally fewer at home than in nursery hospital. The number third is the mother is able to keep an eye upon her children and domestic affairs. This may tend to ease her mental tension. Domiciliary midwifery is also not without disadvantages. The number first is the mother may have less medical and nursery supervision than in a hospital. Number second is the mother may have least stress. The number third is she may resume her domestic duties too soon. Number fourth is her diet may be neglected. Strictly speaking, many homes in India are unsuitable for every normal delivery. Antenatal care. Septicemia may result from unskilled antiseptic manipulation and tetanus nanoterum from the use of unsterilized postmortem. The number second is
Septicemia may result from unskilled and septical manipulations, and tetanus pneumothorax from the use of unsterilized phosphometum. Emphasize on the cleanliness. It entails clean hands and fingernails, a clean suffer for delivery, clean cord care, clean blade, hospitals and health centers should be equipped for delivery with midwifery kits, a regular supply of sterile gloves and drapes, towels, cleaning materials, soap, and antiseptic solutions, as well as equipments for sterilizing instruments and supplies. There are delivery kits available with items needed for basic hygiene, for delivery at home, where a midwife with a midwifery kit is not likely to be present. The aims of good antenatal care are: the number first is through aspice. Number 2 is delivery with minimum injury to the infant and mother. Number 3 is readiness to deal with complications such as prolonged labor, antepartum, hemorrhage, convulsions, malpresentations, prolapse of the cord, etc. The number 4th is care of the baby at delivery rescue stations, care of the cord, care of the eye. Next है family planning. Family planning is related to every phase of the maternity cycle. The mother is psychologically more receptive to advice on family plannings than at other times. The number 2 and the number 3 is educational and motivational efforts must be initiated during the antenatal period. The number 4th is if the mother has had 2 or more children, she could be motivated for puerperal sterilization. In this connection, the All India Postmortem Program services are available to all expectant mothers in India. Postmortem sterilization is generally recommended on the second day after delivery. Although locations confer some protection against conceptions, it cannot be depended upon. Contraceptives have to be supplied immediately post-mortem. IUD and conventional non-hormonal contraceptives are the choices during the first 6 months following delivery. In general, combined or sequential oral pills should be avoided in lactating mother as they do suppress locations. In general, combined or sequential oral pills should be avoided in lactating mother as they do suppress lactations. Intern specific health protections. Anemia. Surveys in different parts of India indicate that about 50 to 60% of women belonging to low socio-economic groups the major etiological factors being iron and folic acid deficiencies. It is well known that anemia per se is associated with high incidental of premature births, postmortems, the Government of India has initiated a program The Government of India has initiated a program in which 100 mg of elemental iron and 500 mcg of folic acid are being distributed daily for 100 days to pregnant women through antenatal clinics, primarily health centers and their sanctuaries. Number second is other nutritional deficiencies. The mother should be protected against other nutritional deficiencies that may occur, particularly protein, vitamin, minerals, especially vitamin A, and iodine deficiency. The next is toximaxis. Tetanus. If the mother was not immunized earlier, 2 doses of absorbed tetanus toxide should be given. The first dose at 16 to 20 weeks and the second dose at 20 to 24 weeks of pregnancy. Next is German measles. When rubella was contracted in the first 16 years of pregnancy, fetal death or death during the first year of life occurred in the offspring of 17% of the pregnancies. Among survivors who were followed up to age 8 years, 15% had major defects, of which contract deficiencies, congenital heart disease were the most common. It happens the risk of all degrees of malformation may remain in the region of 20% up to the 20 week. Vaccination of all school age children with rubella vaccine. Supplementary, the community control of infection is the vaccination of all women of childbearing age who are seronegative. Before vaccinating, it is advisable that pregnancy be ruled out and effective contraceptions be maintained for 8 weeks after vaccination because of the possible risk to the fetus from the virus. Before vaccinating, it is advisable that pregnancy be ruled out and effective contraceptions be maintained for 8 weeks after every vaccination because of the possible risk to the fetus from the virus. It is easily advantageous to show that it is safe, clean, hygiene, cheap and available to the infant at correct temperature. Number second is it is fully meets the nutritional requirement of the infants in the first few months of life.
The number third is it contains antimicrobial factors such as macrophages, lymphocytes, secretory, antistreptococcus factor, lysosomes, and lactoferrin, which provide considerable protection not only against diarrheal disease and necrotizing enterocolitis but also against respiratory function at the first month of life. It is easily digested and utilized by both the normal and premature babies. It promotes bonding between the mother and infant. The number six is sucking. It's good for the baby. It helps in the development of jaws and teeth. Number 7 is it protects babies from the tendency to obesity. Number 8 is it prevents malnutrition. And reduces infant mortality. Number 8 is it prevents malnutrition and reduces infant mortality. The number 10 is it helps parents to escape their children by prolonging the period of infertility. The number 11 is special fatty acids in the breast milk led to increased intelligence, cuteness, and better visual acuity. The next slide is principles of artificial feeding. In planning an artificial feed, the nutritional needs of infants should be kept in view. These include the number first is infants require an average of 100 kcal.
Assalamu alaikum. Bismillahirrahmanirrahim. Healthy mother-child relationship. What are we talking about? Why is it important? When should we start? Plan and practice. Preparing the father. Normal development. High double E. Good parenting. Tips for healthy relationship with your child. Why is it important? Your baby first year is full of changes. You can do a lot to encourage your baby's communication skill. All you need to do is smile, talk, sing, and read to your baby. Why focus on communication? Because early speech and language skills are associated with success in developing reading, writing, and interpersonal skills, both later in childhood and later in life. When should we start? Whenever you are pregnant or thinking about having a children, there is much to consider before deciding to start a family. Plan and practice. In the plan and the practice, it starts with the choosing a name, preparing the father, calculating the budget, working or staying home, who will be the extra caregiver, which doctor, which nursery, which school, having another baby, etc. Plan practice naming the baby a beautiful name that you like can also be some way to create a bond with your baby. You can also be bonding with your baby by being there and maybe take a nap together in the bed or the couch. You and your baby will live a life together, and you as parents are responsible to make sure that your children grow up in a secure and stable environment. Sometimes the bond just happens automatically, and sometimes you need to work on it a little. Assalamu alaikum. The topic is mother-child relationship. Preparing the father. Baby bonding is easiest done one-to-one with each parent. Give your spouse a rest from everything and take care of the baby. Be also sure to spend time together as a family and to bond together as one. This will make strong bonds between the baby and both parents and reinforce the bonds between the parents. Preparing the father. The most natural way to create a bond between a mother and a baby is through breastfeeding. This might make the other parent feel excluded, but there are other ways to bond. You can attend the breastfeeding, or you can cuddle with it right afterwards and relieve the mother for a while. Also, you can proudly carry your baby around. Preparing the father. When close to your body, the baby will start to recognize your smell and voice. Always talk softly to the baby to create stronger bonds and feel more comfortable. Baby development stages. Baby development is predictable, which makes it easy for parents to see if their baby is in normal range or not. However, each baby is also unique. He may be a slow or a fast learner and not follow the typical development stage either. Brain development of your baby. Did you know that a baby's brain develops from the moment he's inside the uterus? When your baby is 16 weeks old, he reacts with the whole body for emotional impressions. After about 20 weeks, he is responding to sound, and all the time his brain is developing. It's the development of brain of your baby. When the baby is about 2 months old, he can clearly interact with an adult. For a short period of time, the baby's ability to mimic stops. Assalamu alaikum. We are studying the mother and child relationship, the brain development of your baby. At 3 months of age, the baby's brain activity increases. If you smile at the baby, he will automatically start to smile. When you stop, the baby will stop. At 5 months, the brain development progresses so much that the baby makes first speak like sounds. The real laugh is first developed when the baby is 18 months old. At 7 to 8 months of age, so the baby brain development has evolved so much that the baby reacts to people he has never met. From being open to anyone, the baby now becomes shy or screams of joy when seeing someone he recognizes. Patience and understanding for your children is important to develop their feelings. Play also stimulates the child's brain. Try to play music. This also strengthens the baby brain development. For a fair selection, everybody has to take the same exam. Please climb that tree. This is the picture. The emotional development of your baby. A baby's emotional development is a lifelong process, and it starts the moment that the baby is born. However, you will not be able to tell its emotional development until the baby is somewhat older. Then it will probably hit you hard, as you need to deal with all kind of emotions that come up. They feel afraid of being left alone. That feeling usually comes when the baby is about 9 months until 2 to 5 years old. Try not to leave children unattended for too long during the period. Babies below 2 to 5 years have no concept of time, and a few hours can feel like an eternity for them. It is therefore important to greet the child when you get back. It is the most important thing. In second part, that babies below 2 to 5 years have no concept of time. It is therefore important to greet the child when you get back. Assalamu alaikum. We are studying mother and child relationship. Emotional development of your baby. He will start feeling afraid, happy, grumpy, and playful. And in the beginning, he will not be able to handle all these emotions. As time goes by, the baby will realize that he does not need to show all emotions, and that some of the feelings perceived can be mastered. You need to encourage your baby's emotional development. Your baby needs to learn what is appropriate and what is not. Try to explain calmly why you have to leave, or ask why he is crying. Defining emotions. Defining emotions is just as with adults, an important process of the development stage. Also be sure that you keep your own emotions out of the play. Show happiness, anger, or anything you might feel, but when dealing with the baby, you need to stay calm and confirm it. I hear so many parents call their children shy in order to save an awkward moment with an adult. Let's stop labeling our children, because when we do, they become those labels. Social development of your baby. Social development is all about learning how to communicate with others, being able to show what the baby wants and does not want, and getting his own ideas. The social development of your baby will become obvious by the age of 2 years. Starting to play and have fun with other children. Your baby will be curious of other creatures of same size and age. Keep an eye on them, as babies have no restrictions when it comes to doing harmful things. Social development of your baby. Also, the baby does not understand the difference between yours and mine. If you give a toy, he will think that it is his, And when you want to take it back, your baby starts to scream or cry and refuse to let go of the toy. This kind of social development is the cause for most conflicts on the playground. The baby will gradually learn the difference and at age of 3 years old, he can share things with others. Another part of social development is to imitate others. When you feed the baby and you open your mouth, the baby will automatically open its mouth too. The same goes for any other movements or behavior. Therefore, it is true that your child will imitate what you do, even bad behavior.